This conference will now be recorded.
Hello students, I'm Dr. Divya from TeenEinstein. So here we are learning about why do we fall ill. That is chapter number 30, and this is the 7th part, the last part of this chapter. So let's see what and all we have learned till now. So in this chapter mainly we are discussing about health and its failure, then disease and its causes, then infectious diseases. A chapter title itself is asking why do we fall ill, or what is the reason of that, how we are falling ill. See, our body should maintain a healthy condition or a healthy situation. What do you mean by a healthy condition or a healthy situation? Means without any disturbances, our body condition, body should go. Okay, that is a condition of wellness. Right. So, well means you should be well mentally, physically, and socially. Right. Socially, you should be good. Physically, you should be active. And mentally also, you should be in a good condition. That says you are a healthy person. Okay. Any disturbances for all these three conditions, either it may be physical disturbance or social disturbance, or so that social condition, social well-being is going off, or mentally you are getting disturbed, you will not have a healthy body, or you will not stay in a healthy condition. Okay, see, some kind of mental disturbances also will affect us, physical disturbances also will affect us, and social well-being, that is very important for our healthy condition. So health and its failure, what do you mean by failure of this health? The healthy means state of being well enough to function well. Physically you should function well, mentally you should function well, and socially also you should function well. If you are able to stay well in mentally, physically, and socially, that is called as a healthy condition, right? So that healthy condition is changing, or it is getting disturbed. Disturbance, that healthy condition that is getting disturbed due to some issue, maybe mentally you're getting disturbed, or physically you're getting disturbed, or socially, social well-being, for that some disturbances are happening. Due to any of this reason, your health, the complete health is getting disturbed, right? See, physically will be okay, socially also will be okay, but if you have some kind of mental disturbances, like some kind of tensions, definitely that is going to affect your health. Okay, because our body, each and every part of our body or each function is interconnected, right? Mentally, if you are not well, that will affect each and every process. Because if you are getting tensed, just imagine, if you are getting tensed, you will not be eating well, right? You won't feel like you are hungry or something. Always you will be like somewhat sleepy, like you'll be sitting quiet, right? But that will not solve your problems. So you should be in an active mode. If you're mentally you're getting disturbed also, you should be in an active mode. You should think about how to come out of that issue, because our body need a healthy condition, right? So if anything, any of this condition like mental, physical or social condition, anything is getting disturbed, definitely it is going to affect your body. So finally, who is the loser? We are the loser. Our health is getting disturbed. So what will happen here? That disturbed condition, that is very important to come out of that disturbed condition, right? Otherwise it may lead to serious health problems. So personal and community issues both matters for health. Okay, so we should solve that problem, we should come out of that problem. So that health issues are called as, or that disturbances of that healthy condition, that is called as illness, right? So here many issues like including public cleanliness, that is important for individual health, right? Then for healthy condition, to maintain that healthy condition, we need healthy food, right? Healthy food we need to eat, a complete food we need to eat. And for that we need to go for work, we need to earn money, so we need opportunity to work, that also should be available. So to make ourselves happy and truly healthy, we we should work a lot, right? So socially, that social equality and harmony, that is necessary for that individual health. So we can think of many examples and we can connect all this with our life also. So all these things are very important for well-being. And we have discussed about the distinction between healthy and disease-free condition. Okay, so we can easily see that it's possible to be in a poor health without actually suffering from particular disease. There won't be any particular disease, but that that person's health will be in trouble, or that person won't be in a good healthy condition. If you are checking, there won't be any particular disease, means they will be having some kind of mental disturbances, that also may be a reason. So good health, we need to keep a good health. So according to our profession, see, if you're a teacher, you should be free from mental issues, like you should read a lot, you should teach. If you are getting disturbed, you could not explain the things well. And if you're a singer, you should, the throat infection, you should always keep your throat in a safe mode. And for dancer, physical energy is required. So it is according to your profession, you should maintain your health. Okay, so to have opportunity to realize the unique potential in each of us, we need to maintain a really good health. Okay, and what is disease, or how a disease condition looks like? How we'll come to know that there is a disease, or how we know that there is something wrong in our body, like that some physiological system or organ system, something is getting disturbed. Okay, and that is having some particular function. So what will happen? See, just think about the digestive system. If our digestive system is not good, means it is getting disturbed somehow, some acidity or gastric issue is coming, what will happen? It won't function proper way. So if it is not functioning, how our body will get energy? The whole body need energy, that is getting from food, right? So it is finally affecting all other parts of our body, because everything is connected. If we don't have energy, we cannot walk, we cannot work, right? So there are so many things which are interrelated. So when there is a disease, either the functioning of one or more system of our body will change in a worse condition. Sometimes it will go in a worse condition. So that changes due to disease, that is called as, so it will arise some kind of symptoms, right? Symptoms. What do you mean by symptoms? These are the signs, or these are our body is expressing that our body condition is not good. So in some or one or the other way it will express, right? Symptoms are the signs of disease. Okay, our body is indicating that some parts of our body is having some kind of disturbances. Okay, then we have learned about different types of diseases, like acute disease, which is lasting for few days and we can recover from that by maintaining healthy food and rest. Okay, then chronic diseases means that will last for several days, and sometimes it may last for long time, means lifelong it will be there. So such diseases may affect our whole body health, because if you are in a stage of disease for several days or several months and whole lifetime, definitely it will affect the other organs also, or the whole body functioning may be in trouble. Okay, so that's why chronic diseases are long lasting. So that will make a chronic disease will make it difficult for us to follow what is being done till that day, right? So in other words, we can say there will be a prolonged general poor health. Okay, health will be poor for a prolonged or for a long time, we can say. So chronic diseases have very drastic long-term effects on health. Okay, compared to acute disease, that is a problem of chronic diseases. And what are the causes of these diseases? Causes also we have learned. So there are so many levels of these causes. Okay, see, one reason may be poor health, right? And sometimes may be due to genetic problems. So there are several reasons, right? And sometimes it may be due to poor hygienic conditions. Right, that's why if you are approaching a physician, they are asking several questions like what and all you are eating, what and all you are drinking, how is your daily habits, how it is going on, whether you are sleeping properly. That is, they are making sure that from which level their treatment should start. So first, definitely they'll start from the basic level, and they're asking about each and everything what you have done in 1 week, right? If you are not taking rest, that means you are not sleeping, that also may affect your health. So mentally, if you have any disturbances, that also they'll ask, definitely they'll ask like whether you have any tensions or any other issues, like that also may affect whatever. If you are eating well, drinking well, and if you have some kind of disturbances, that may affect your health. How? Because you won't be able to sleep properly. So that sleeping is a complete rest for our body, so that is not there, definitely your body won't work well. It will affect the digestion, it will affect the energy of our body. So finally some kind of issues that is going to raise, but when they are checking, you won't be having any problem, still you will feel like you don't have energy, right? So a poor health, maybe because of that may be the cause of disease. Some kind of genetical issue that also may cause disease. Then poor health conditions or hygienic conditions. So all these are, or all these may be the reasons. So first we need to find out what is the reason, right? So next we had learned about infectious and non-infectious causes. See, some diseases may spread from one person to another person. So there we need to think whether all the diseases are spreading from people, one person to another person, whether all diseases are communicating in that way. And some diseases won't spread, like non-infectious diseases, they won't spread from one person to another person. So one person, like this infectious diseases we told, that is spreading one due to communication through air, through water, so like that it can transmit from one person to another person. Sometimes vectors also may help for this. And non-infectious diseases means it won't spread from one person to another person. Okay, like cancer and all, it's not spreading from one person to another person, right? If a person with cancer, that also in a serious stage, if they are sitting with us and talking to us also, it won't spread to us, because that is due to some kind of genetic abnormalities, right? So how a person is developing those diseases which are not spreading by contact, that may be due to genetic abnormalities and all, right? Then we have learned about some infectious agents, like infectious diseases and the agents which are causing that, about SARS, then Staphylococcus, Trypanosoma, Leishmania, then Ascaris lumbricoides, all these agents we have learned. Then how the diseases are spreading. How diseases are spreading? So some diseases, they are through microbes, I said, and through air, through water, and through vectors or some agents, right? By direct contact may be there, like we are giving handshakes or something, and through air, that means through that droplets, it is spreading, right? Sometimes that infected person, while indirect contact, like through their dress or the vessels or whatever they are using for eating and all, then through food or drinking water, contaminated food or drinking water also, from a infected person to a healthy person, it can spread. Sometimes vectors like mosquitoes or some insects, that also can come. Okay, so these are the common methods of transmission of diseases. Okay, and one thing we need to remember, that all these diseases that may affect specific organs, right? Then if specific organ is getting affected, there are some methods for the treatment, right? So when you're falling sick, they, based on the symptoms, which are developing in our body, based on that usually treatments are taking place, right? That's why, see, for viral infection and bacterial infection, protozoal infection, for all these we are taking different types of treatment. For viral infection, for bacterial infection we can take antibiotics, but for viral infection we cannot take antibiotics, right? It won't work. First of all, it won't work because antiviral medicine, it is harder to make. What is the reason? The reason I said, when a viral particle is entering inside a host cell, when it is entering, it is becoming the part of that host cell, because virus doesn't have a complete body. It is having the genetic material, and that genetic material will get integrated with the host cell. then there it is getting multiplied. So when we are treating with a drug or a medicine for that viral, or when we are making a medicine which is antiviral, it is affecting the whole cell, right? So our body will also get affected with the same medicine. So what we will do, usually what we are doing, that biochemical pathway is getting blocked. Okay, their biochemical mechanism of that viral particle, that is getting blocked. That's how we are controlling the microorganism. Okay, so some drugs like for HIV and all, to keep them under control, it is developed. Now the principles of prevention, that's what we are going to learn. How to prevent. See, always we used to say that prevention is better than cure, right? First we need to prevent the disease. So when we should not wait until it is getting developed or getting expressed in our body. So first we need to prevent. If we are coming to know that in our area some diseases are spreading, first we need to prevent, right? Because if it is getting affected, our health is going to get disturbed. So instead of that, we can prevent, we can take maximum preventions. So prevention of diseases. So what and all we used to do? So all of what we have talked about so far, that deals with how to get rid of an infection. Now we have learned about infection and the symptoms, how it is developing and how the diseases are spreading, all the infectious diseases are spreading. So we have learned everything, right? So we can avoid that kind of situations. So how to get rid of an infection in someone who is having the disease? If some person is having disease, right? So how to avoid spreading? How we can avoid that spreading? First of all, that infected person should have that in their mind. See, if I'm going away from such people for few days, that can avoid spreading. At least they can help their family members, right? So, but there are three limitations for this approach to deal with the infectious diseases. Limitations are there. So, what are they? The first limitation is that, see, someone has a disease and their body functions are damaged, and we will come to know that they are not going to recover completely. See, we can avoid spreading, but here some limitations are there. No recovery is possible. Such conditions may come, right? Their body functions are completely damaged and they will not recover completely. Okay, and the second one, that means treatment will take time. See, it's not possible to recover within 1 week or 10 days and all. So that treatment may take time. That means that someone is suffering from a disease is likely to be bedridden for some time. See, even though we are giving proper treatment, there is a chance of taking time. In the first case, we can say like prevention, the principles of prevention, we can prevent, but there are limitations for this. Limitations in the sense, in 2-3 cases, there are limitations. See, complete recovery may not be possible in some cases because their health condition will be very poor. Maybe due to that disease or previously they will be having some kind of diseases. So a complete recovery is impossible in such cases. Okay, and second chance, like they may take time, and there is a chance of bedridden condition also. They can recover, but that recovery may take time, and bedridden conditions also may come. Okay, But if they are giving proper treatment, there is a chance of recovery. And the third condition is the person who is suffering from an infectious disease, they can serve as a source from where the infection may spread to other people. Okay, so that may lead to a difficult condition, like multiple people may get the disease, right? The suffering person can work as a source of infection, right? So that person, if someone is helping, someone is staying with them to help them to recover their health, this infected person can spread the disease to that person who is standing there for help, right? Who is staying with them for helping them. So that may become a chance, right? So that infected person is working as a source. So that is also a difficulty. So people will be afraid to take or to give a helping hand, right? So all these things leads to the multiplication of above difficulties, like the recovery of the person, right? So it is because of this kind of reasons prevention of disease is better than curing. So for preventing, first we need to think about the prevention, okay, not about curing. Curing is difficult because there are some limitations for curing. Sometimes their health conditions may not support complete recovery. That is one reason. Then second chance, like or second condition is, there is a chance of taking time. If the person who is getting that infection, they have or they came to a level that they have serious or severe infection, it may take long time to come out of that, right? And sometimes that may lead to a bedridden condition also, right? So it may take time. In first chance, there is no complete recovery, okay, that may be due to their health condition. In second way, we are saying like it may take time because of the severity of that infection, and that may lead to bedridden condition also, but there is a chance of recovery. And the third one, if a person is getting infected from that suffering person, other people, those who are there for helping these infected person, they may also get the infection. So people will get afraid of helping such infected people. So we have seen all these in a pandemic situation like COVID, right? So during that situation, there an isolated condition was created, right? Quarantine, everything they suggested to avoid the spreading of that disease, right? If one person is getting infected in family, that person should get isolated from other people, because there is a chance of spreading this disease, right? So people may get tensed even to help their own family members. If the family members are getting infected, anyone is getting infected, other members will get tensed because they'll be having a tension that it will spread to them, right? So always, instead of taking a chance, we can try to prevent these diseases instead of curing this disease after infection. So how can we prevent this disease? That's the question here. How can we prevent? See, there are two ways to prevent. First one is one general method, and that will be specific to each disease. And for each disease, it's specific. Okay, that's the first way. So what is the general method we usually we used to follow? Like exposure to that condition. See, if one person is having infection, that person should get isolated, right? So exposure to such diseased condition. Exposure should be reduced. So exposure, general ways of preventing infection is mostly related to preventing the exposure. So how can we prevent exposure to infectious microbes? How is it possible? How can we prevent our exposure? See, we know that that disease is spreading. So we can get some easy answer like how to reduce the exposure. How we can answer that? We can avoid overcrowding, overcrowded situations. Avoid that, right? That's what we did during COVID also, right? So overcrowding can be prevented. So for airborne microbes, we can prevent exposure by providing living conditions that are not overcrowded. So airborne means, see, if you are choosing an AC hall, air conditioned hall for a function, what will happen? Definitely it will go for minimum 100 people, right? If one infected person is there and that is a closed area, definitely other people will get, right? Those who are having high immunity may get survival from that condition. And for waterborne disease, this is for airborne. Many means of spreading is there, right? So for airborne disease, you can avoid the overcrowded situations. Then for waterborne, we can prevent exposure by providing safe drinking water. Safe drinking water. This is for waterborne disease. Okay, we should give boiled water always. See, if you're going for a function and all, what they will do, half they will boil, half they will mix the ordinary water. So is there any use whatever you're doing? No, everything is getting wasted. Your boiling work also getting wasted. And sometimes the filtered water, you should drink always safe drinking water. So this can be done by treating the water to kill any microbial contamination. So you can treat the water to avoid the microbial contamination, right? Then for vector-borne disease, we can provide clean environment. This is for vector-borne disease. See, vector-borne disease means, see, mosquitoes and all working as a vector for spreading malaria and all such dengue fever, malaria, so such things and all. Mosquitoes are working as the vectors. So mosquito breeding you can prevent. That's what I mean by clean environments. So for example, here you can see mosquito breeding. To prevent mosquito breeding, if we are preventing mosquito breeding, there we can prevent several diseases. Several diseases like there, what do you mean by all these things? Public hygiene is the basic thing or basic key to the prevention of infectious diseases. Okay, public hygiene. Okay, so apart from all these things, additionally, we need to discuss some issues like there are some principles to prevent these infectious diseases. Okay, there are some principles to prevent these diseases. Okay, but why we are not bothered about such things so far? See, normally we are facing with several types of infections nowadays, right? So if someone is suffering from cold and cough in a classroom, the children who are sitting around that infected child, they will get that infection, but all of them won't get. Okay, why all of them won't get? This is because, see, one child in a classroom, one child is infected, and there are another 29 children in that same class. Okay, total number of students 30. One child is infected, and another 29 students are there. 29 children in the same class, but all 29 children won't get, because their immune system is working against that microbe. Okay, that infected child is having severe infection, so there is a chance to get all other students the same infection. See, in that much severe condition that infected child is. Okay, but all the students, all the children won't get. Why? Because immune system is working. Immune system is working. So all we have cells which are specialized in our body. Immune system is there, and those cells are specialized in killing the infected microbes. Immune system that will kill the infecting microbes. Okay, so these cells what going to action each time infecting microbes are entering their body. Whenever an outside particle or outside thing which is not present in our body, it is entering into our body, whether it is a microbe or a particular thing, our immune system will get activated. So our immune system will start working against this microbes. Okay, so whenever a microbe is entering into our body, these immune cells will go into action every time, and if they are successful to defend against this microbe which is entering in our body, immune system that will fight, and the immune cells are winning in this fight or in this defense, what will happen? We won't get any disease. And if the microbe is having capacity to fight against the immune cells and that can enter inside our body, that microbe is winning there, right? So microbe is winning in that fight and it is entering inside our body. Like that it is happening means definitely we will get infected. So immune cells manage to kill off the infection long before it assumes major proportions. Okay, if the number of the infecting microbes is controlled, the manifestation of disease will be minor. Okay, so if we are approaching a physician, first he will take the basic treatment for controlling the multiplication of that microbes in our body. So there, the multiplication of that microbe or that infection or that infecting microbe, their multiplication, their number is increasing, right? In our body, it is getting multiplied. So that multiplication is controlled means there will be very less number of microbes in our body, so that our body can fight against those microbes and kill them, right? So becoming exposed to or getting infected with an infectious microbe, that doesn't have a meaning that we will get the same infection, right? Because our immune system is proper, or if immune system is active, there is a less chance. If our immune system is working well, there is a less chance of getting infected. How our immune system will work? If our body is in a healthy condition, if we are healthy enough, we are eating well, we are taking proper rest, and everything is going well, our body will be in a good condition. so that our immune system also will be in a good condition to fight against all the microbes which are entering inside our body. So up to an extent we can prevent ourselves from all these kind of diseases. Okay, so one way of looking at severe infection or infectious disease is that lack of successful immune system. If we don't have a successful and healthy immune system, definitely we'll get all the minor infection also. We cannot survive in such kind of situation. So we'll get infected. So instead of that, make your immune system, boost up your immune system. That's what you can do. Okay. So the functioning of immune system, like any other system in our body, that will not be good if proper and sufficient nourishment and food is not available. That's why we are asking to eat well, to sleep well. So these things are the necessary things or necessary care which we need to give for our body. First, we need to eat a nutrient rich food. Okay, if all the cells all over the body we are getting all nutrient supplements, definitely our immune system also will get, right, that also will be in a healthy condition, so that we can fight against all the diseases. And the second and the basic principle of prevention of infectious disease, that is the availability of proper and sufficient food. So about immune system, our immune system, managing and maintaining our immune system in a well and good condition, that is very important. Okay, so these first thing is maintaining our immune system always in a good condition, then eating well and sleeping well, proper taking proper food or sufficient food and good food, that is very important, nutrient rich food. See, it doesn't have a meaning that you need to eat 4 or 5 times in a day and you need to eat a lot. Whatever you're eating, make sure that that is a healthy food. That is, those are good supplements for your body. Okay, so that makes, or these are the basic principles to prevent the disease. Okay, so these are the general ways to prevent the infections. And what are the specific general ways we said? First, to maintain our immune system in a good condition. And what are the specific ways? Specific ways, that means that is related to peculiar property of the immune system, which are usually fighting in the microbial infections. So for example, we can say these days there are no smallpox, right? So in your textbook they have given example of smallpox. Smallpox nowadays it's not there, right? In society it's not there nowadays. Okay, but like 100 years ago, smallpox epidemics were not at all uncommon. It was there 100 years ago. Okay, so when one person is getting infected with the smallpox, people were afraid of coming near to someone who is suffering from that disease, because there is a chance of spreading smallpox. So 100 years ago, up to that time it was there, and that will lead to serious conditions. Think about the medical conditions which are available now and above 100 years, how it was. So smallpox, that was a serious disease at that time, and some people were not ready to take care of the infected people. So there was one group of people who were not having this fear. Okay, because these people, and those people, those who are not afraid of such diseases, they were providing the nursing care for the people, those who are affected with smallpox. Okay, so who were doing that? See, smallpox was a serious disease that time. Okay, so one set of people one set were away, or they were not ready to help even the people, those who are infected from the smallpox. And another set of people were doing all nursing work. Okay, and these set of people, they had smallpox before or earlier, and they survived from that. Okay, so they were having a lot of issues, health issues and all, and they were having lot of scarring, even though they had smallpox long back, and they survived from that. Okay, so here we can say that once they had smallpox, there was no chance of getting it again. So having some diseases once in lifetime, it is giving permanent, or they are not going to suffer from the same disease again. Even now we know chickenpox, like once if we are getting infected with that, our body will be having that prevention, like we won't get subsequent attack of the same disease, right? So this happens when the immune system first sees the infectious microbe. So first, when we are getting infection, our immune system is getting, or our immune system is noticing that microbe, right? And that remembers the nature and how to fight against that. When that next time that particular microbe is coming, or any close relative, next time our family member is getting infected with the same thing, and that time we are getting that exposure, right? So what will happen? Even the same microbe, or the near their close relative kind of microbes which is entering in our body, our immune system will respond, because our immune system knows how to fight against that. So our immune system will respond, and even a greater vigor, in that way, in a greater way it will respond. So that eliminates the infection even more quickly than the first time, which first time that might have taken long time to go or to cure from this disease. But next time when the same infection is coming, or same type of infection is coming, what will happen? Our immune system will be having that in their memory. So what they'll respond in a way which it wants, because first time to study about the microorganism itself, immune system will take time, then only it will respond, right? In all the possible way it will try, then it is responding, then it's curing. So next time when you are getting the second time the same type of infection, our immune system knows already, it has learned how to fight against this one, so it will respond in a quicker way, so that it can eliminate the infection even more faster way. Okay, so that is the basic principle of the immunization. Immunization means before the entry itself, you are training your immune system how to respond against that. So that's how body is responding in a faster way. So that's why now people are asking to take immunization or to take vaccination and all. Clear? And here, see, English physician named Edward Jenner. He realized that milkmaids who had that cowpox, they did not catch smallpox. Even during that epidemic condition also, they didn't get smallpox. And you know that cowpox is a very mild disease. It's a mild disease. So during that condition, there was a serious issue of a smallpox. These milkmaids, they didn't get the disease. So what this physician Edward Jenner did, he tried deliberately giving cowpox to people. Okay, so he started giving cowpox to people because it's a mild disease. And he found that those he gave that cowpox, slight way of cowpox, they were resistant to smallpox. They were resistant to smallpox. See how we explained about immunization, the same method is working here. Okay, this was because the smallpox virus is closely related to cowpox virus. Smallpox virus is closely related to cowpox virus. Okay, so already our body got an introduction of this cowpox virus, right? So that time what he did, Edward Jenner, he introduced cowpox virus into body, and he observed that those people who got already these cowpox virus, which is a mild disease, they are resistant or they are not getting the smallpox infection, because the smallpox virus is closely related to cowpox virus. So their body came to know that how to respond against or how to get resistant to this condition. So their body already developed a power or immunity. They developed an immunity to resist against that smallpox virus. Okay, so smallpox virus is closely related to cowpox virus. That's why they didn't get the infection. Okay, so here cow, in Latin, what we will say? Vacca. Vacca for cow. Okay, and cowpox. For cowpox in Latin, they were saying vaccinia. Okay, from cow it's coming. So vaccinia, cow means vacca. So cowpox means vaccinia. So from that root, vaccination. Vaccination. From that, on basis of that, they gave the name vaccination, and that came to, nowadays we are using this word vaccination, right? So there, as a general principle, we can say that we can fool the immune system into developing a memory for a particular infection by putting something which is almost similar or which mimics the microbe we want to vaccinate against into the body. So that doesn't actually causes the disease, but that will prevent any subsequent exposure to infecting microbe from turning into that actual disease. That's why we are giving vaccination. Okay, so many vaccinations are available nowadays. While uh, giving birth to one baby, that time along with the baby from hospital, they'll give a chart, these many vaccinations you need to take, and in this age you need to take particular vaccine. Okay, so many such vaccines are available now for preventing the whole range of infectious diseases. Okay, so there are vaccine against tetanus, diphtheria, whooping cough, measles, polio, and like that many other diseases. They have vaccine, they have developed vaccine, and to develop a vaccine it's not easy. They have to conduct many trials and it will take years, okay, to get a complete and good vaccine which is not developing any other issues in human being. Okay, so these are for public health. They are maintaining such programs like childhood immunization. Okay, that is to prevent the infectious diseases. So such programs are definitely, they are useful, and they are helping the children to develop, to boost up their immunity. And some hepatitis virus which is causing jaundice, they are transmitted through water. Okay, so there are vaccines for hepatitis also nowadays, like hepatitis A, hepatitis in the which is available now for such diseases also. Okay, so when after taking that vaccination, when they are getting exposed to such diseases also, they won't get that disease. Okay, so that's how we are protecting ourselves from vaccines, by giving proper immunization or vaccination at right age. Okay, so these are the main things which you are learning in this chapter. So what and all we have learned? Health means that the state of physical, mental and social well-being, and health of an individual, that is depending upon their physical surroundings and their economic status. Then disease, they are classified into acute disease, chronic disease, like that, two categories, and that is depending upon the duration. And diseases, they may be due to infectious or non-infectious causes, disease may appear. The infectious agents, they are belonging to different categories, like they may be unicellular, microscopic or multicellular, and they may spread through air, through physical contact, through vectors, through water. So what we need to do, we need to prevent the disease. That is better than curing the disease or taking treatment. So infectious disease, those can be prevented by public health hygiene measures, and we can reduce the exposure to infectious diseases, right? Then by immunization also we can prevent diseases. So how we can say that effective prevention? What is effective prevention of infectious disease in one community? Because everyone should have the knowledge about public hygiene, right? Public hygiene, that is very important. Everyone should be bothered about the public hygiene. And what is the importance of immunization? Okay, so importance of immunization and public hygiene, we should bring into everybody's notice that these two, public hygiene, maintaining public hygiene, and in the what is the importance of immunization, what is the role of immunization. So people should have the knowledge of hygiene, public hygiene and immunization. That's very, very important. Okay, so these are the things which we are learning in this chapter. Why do we fall ill? Actually, this is a good chapter which is having importance in our life, right? So after learning all these things, you'll be having a at least 50% knowledge how you should maintain if you are getting, or if you are falling ill, how to, in which stage you need to approach a physician, and how to handle the disease without spreading to other person. So here in this age, this is a very good chapter which you are giving a knowledge. Okay, so that's all these concepts, I hope it's clear. So you can answer all the exercises which they have given in this chapter. I have discussed almost all the questions while discussing about the topic. So here, this is